My name is Venkat Ramakrishnan. I'm a consultant plastic surgeon. I work at Mid-Essex Hospitals Trust. That's my NHS appointment. And at the Nuffield Hospital in Brentwood. That is my private practice. Usually people have a reason, isn't it? They have a story, but I don't have a story. I became a doctor because my dad was a doctor. And my dad was a plastic surgeon, so I became a plastic surgeon. I just sort of looked at him and then followed his footsteps. I grew up in Madras, which is southern part of India. It is a very southern tip of India. India is like a peninsula, the very tip, very close to Sri Lanka. Madras is the place. There are two things. One is the patient contact and trying to sort of, it is like analyzing the problem the patient comes with and understanding the problem. It's more so with cosmetic surgery to understand the psychology behind the patient and what the expectations, and counseling them to make sure that they understand what the limitations are and what we can achieve realistically. And that becomes a big sort of not an affair, a big problem and a solution solving issue, which I quite enjoy. I try to sort of, as I get more senior, I try to sort of get to the point much more quickly, and I'm able to really pinpoint what their problems are. And when they say, yes, that's the thing, and then it gives you lots of satisfaction that you're doing the right thing and you're using all your experience to get there. The second bit of this is the kind of adulation and I should say admiration the patients have for us, which is such a privileged thing. It's not in many professions you get that. The patients sort of are so thankful when things go right, and when you've advised them and they've listened to the advice. Sometimes it's not what they wanted, but then it has gone right. Then they say, "Oh, thank you, doctor. You said the right thing, and you didn't just push me to have another operation or whatever." Those kind of things are very valuable for a doctor. The devil is in the detail. It doesn't matter what, anything. It could be a clinic appointment for a patient or the most difficult surgery. It is to the last dressing, the garment, or the little advice booklet. Those are the important things. It's just not surgery. And a second thing is all we do. I mean, you see surgeons many times, doctors. There is a big battery of people who are supporting us behind us, and the theater staff, the people in the clinic, the dressing nurse, the person at the reception, and that is the sort of you tend to start relying more and more on the team, and you believe in the team and less in yourself to an extent, because when you start out practice, when you're sort of this young surgeon, you think, surgeon, I'm the person, but then you realize how important all the other people are for the patient.